Hi everyone, it's been a while. I'm Dr. Natasha Iyer, and today I want to talk to you about heart health. You know, I think a lot of people spend a lot more time preoccupied with cancer, and there's nothing wrong with that. My own mother had 2 different types of cancer. The thing is, more women die of heart disease than they do of breast cancer each year. And I find that it's a topic that not too many people spend enough time on. The old myth that my cholesterol is great and so I'm fine. You know, I'm not overweight and so I'm fine. Well, there are multiple topics I'm going to be touching on over the next few weeks that will help you understand how to really reduce your risk for heart disease. Women are about the worst for heart disease because we don't present typically. So whereas men might get that crushing pain, that feeling of the elephant on their chest, you know, the jaw pain, this is my left side, radiating up this way, women present with heart disease differently. So today I'll just talk about how women present differently. We could have heartburn and diabetic men will present differently as well. So remember that as well. Because diabetes changes your nervous system and how it reacts and how your symptoms show up. Women can have heartburn, indigestion, a feeling of discomfort. I can't tell you how many women I've seen in my years in ER with indigestion, heartburn, just weird feelings in their chest. They might have isolated jaw pain, not just radiating into the jaw or down the arm. They might just have arm pain. And I would say to you as a woman, once you are older than 40, you need to pay attention to anything that feels unusual. You'd rather go get checked out than disregard it and it be too late. We have a critical period where we can pick up some abnormal enzymes in you and then take action so that there's not permanent damage to the heart muscle. Another isolated symptom could just be shortness of breath or coughing and shortness of breath kind of things. How do you know you're at risk? One, we know that estrogen is protective. So cycling women, younger women who have menstrual cycles, are theoretically protected. Once you're done and into the menopause, and if you have no hormone replacement, then you are at higher risk. Now, here's the very contentious issue. If you read the Heart and Stroke Foundation, and they talk about the estrogen being protective, they talk about taking hormone replacement therapy as not being protective. So let's distinguish the difference between bioidentical hormones and synthetic hormones. We know that synthetic hormones are associated with more disease risk in women. In fact, the Women's Health Initiative study was stopped early because the synthetic progestin, which is man-made and foreign to the human body, was implicated in all of the increased incidence of diseases and side effects and early death of women. But if we look at what bioidentical hormones are, they're identical to what your body made when you were a cycling woman. And we just said that women who are premenopausal are protected by the beneficial effects of estrogen on the cardiovascular system. No estrogen is safe in this day and age. And why? Because of all the things I've been talking to you about, toxins and how your body doesn't handle it. And so we know that how you metabolize estrogen has been altered. It's been affected by everything from the environment, your genetics, and how your body responds. The thing about bioidentical estrogen is, even though it's not safe when it's not monitored, in functional medicine, we have ways to replace your estrogen and monitor that your body is handling it in the right way so that you are safe in the long term. So ultimately, your risk can be modified. And that's all I wanted to mention today. Women are at higher risk for heart disease than ever before. Postmenopausal women are even higher. Beware of the information you read. Sure, the Heart and Stroke Foundation is something you might take as a trusted resource. There's some good information there, but they recommend you eat margarine, like really. They recommend that you take Weber Naturals fish oil. Really, Not all fish oil is equal, and much of it is toxic and filled with heavy metals, which can increase your risk for heart disease. Women present differently with heart disease, and so women, please take care and know that having a normal cholesterol means nothing. More than 50% of men and women who have heart attacks have normal cholesterol. So what else is there? Every day I'll be talking to you about the different things you need to know about heart disease risk, and what you need to do about it. So stay heart healthy, and I'll talk to you soon.